In the middle of this pandemic, we have a big heads up. It's not too late to get a flu shot.
No, and it's very important that you get one. Dr. Audrey Stevenson, the Director of Family Health at the Salt Lake County Health Department, is with us live via Zoom to explain why. Dr. Stevenson, thank you for joining us. Let's talk about how important it is this year to get that flu shot, more than ever.
Well, good morning, everyone. And it is not too late to get a flu vaccine. With so much information that we're hearing about the COVID vaccine, I think many in the public have forgotten we still have an effective way of being able to reduce influenza in our community. It's really important that individuals get an annual flu shot. It's really our best way to protect our families from illness during this season.
You know, and I think for a lot of people, they may be thinking, well, okay, so I get the flu or I don't often get the flu. Why do you think it's not worth risking it right now, especially when we consider how many people are already in the hospitals with respiratory illness?
Well, as a mother and also as a healthcare clinician, I think it's really important that we all do everything that we can to reduce the spread of influenza. You mentioned about the hospitalizations, and influenza is really a devastating disease. It's not just a bad cold. And right now, where we have hospitals at capacity, individuals who have influenza may be at risk of having pneumonia or other complications related to that disease. And so it's important we do everything we can to protect ourselves.
Okay, maybe you can clear this up for us. I've heard different answers to this. Is it possible to get COVID and the flu simultaneously?
You know, the same behaviors that cause the transmission of the coronavirus are also risk factors for getting the flu or other respiratory types of illnesses. So the same situations that would make us vulnerable to one can make us vulnerable to the other. So absolutely, an individual is capable of getting multiple diseases at the same time.
Now, depending on what poll you listen to, and we try to listen to the right ones, about 40% of people are saying that they don't want to get a vaccine for COVID-19 when it comes out because they're worried about this being fast-tracked and worrying about the safety and the side effects. What do you think, as an expert in this? Do you think that when we get an actual vaccine approved for COVID-19, will it be safe, and should people get those?
I absolutely think it will be safe. I don't believe that there have been any steps that have been skipped in being able to determine the safety or efficiency or efficacy of this particular vaccine. And I think that it is going to be one of the best ways for us to finally stop this spread of this pandemic. So I plan to get vaccinated once it's available to me, and I plan to have all of my loved ones get the vaccine as well.
Okay, and as far as those flu shots, how long are they effective once you get one? So we've got a long winter.
Yes, and a flu vaccine actually protects you for the entire season. So it's not too late to get a vaccine if you have been too busy or just haven't had an opportunity to get a flu vaccine so far this season. There are a number of places where you can get a flu vaccine. It can be received at your local pharmacy, local health departments, your healthcare provider. And in fact, we have a number of free flu vaccines that are available within the community for those individuals who don't have insurance or have no other way of receiving a vaccine.
Okay, well, it's so important as we're hearing from healthcare providers all over the place. We've got just one last second that I want to ask about this. We were talking today in the news about Moderna being able to get their authorization. They're actually asking for it today. How long will it take after they request authorization to get it?
The emergency use authorization can take up to several weeks. I know that the federal government is trying to expedite the approval process so that we can get this protective vaccine to those who need it most as quickly as possible. So I would look to be seeing in the next few days or few weeks that emergency authorization coming through.
Okay, we're hopeful. We've got the flu vaccine now, so get that one. And according to you, get the COVID vaccination as soon as it comes out, as soon as it's available to each individual. Yeah. Dr. Stevenson, thanks a lot for taking the time for us this morning. Appreciate it.
Good information. Thank you.